like to call the November 10th, 2014 Human Services Committee meeting to order. You have the agenda printed in front of you. I'm looking for an approval, please. Support. I have approval and support. Any comments, corrections, additions? Seeing none, all in favor say aye.
Aye.
Opposed? Motion passed. Public comment. Is there any public that would like to address the board? Seeing none, we'll move on to committee items. We have the meeting minutes of October 13th attached.
Move to approve. Support.
We have a motion and support to accept those meeting minutes as presented. All in favor say aye.
Aye.
Opposed? Motion passed. Lifeways report. Mary Beth.
Good morning.
Good morning.
You should have in your packet my report for this month. A couple of things that I want to point out. First is related to the Wellwood Award. In the packet, it kind of describes what that was. It's an award that's given out every 2 years to a community mental health for their partnership related to advancing services for individuals with mental illness through what's called peer-delivered services. So this award we actually received with ARE, which is our drop-in center locally. And this, just wanted to share that because this was pretty phenomenal that we actually received this award. When we talked about the challenges that Lifeways has faced related to general fund, one of the things that I shared with you was that we looked at creating some creative options for individuals who are uninsured and reached out to our providers to find out who might be interested in doing something. And the drop-in center actually was one of the providers that approached us with a peer-delivered group, wellness group for individuals who are just starting to have some difficulties. And we put the individuals on the waiting list, and then when we reached out to them, when we had the availability of funding to offer services, they actually were enjoying the group so much and felt that it was so beneficial that they did not want to receive traditional community mental health type services. So they're doing a phenomenal job. This is a joint award between the community mental health and life and the ARE, but I wanted to share that with you. The other thing that I wanted to point out in your packet is related to some updates. We had our association's fall conference, and at the fall conference there was some discussion about some strategic direction. As you may have known, Haveman has stepped down, and Nick Lyons has stepped in his place for leading the Michigan Department of Community Health. And they presented at the conference related to what were the 4 strategic priorities that he sees for 2015 when working with the community mental health and the system as a whole statewide. And the 4 things that they talked about was promoting wellness and recovery. So that obviously is something that we already have in our strategic plan for this coming year. Moving the system forward related to activities that look at the person as a whole and not just their behavioral health. Improving outcomes for children. They really want to see that we move forward and even further the advancement of autism services for children in the state of Michigan. We have done a lot locally related to that, but statewide it's been a challenge related to capacity because the service actually has some specific criteria, credentials that individuals have to have related to delivery of this ABA benefit, this autism benefit, and statewide we've been challenged with finding the resources. So that's one of the things that is one of their strategic directions, transforming the healthcare system. So that's really looking at, again, how do we work with our local communities, how do we move forward with looking at model payments that are different so that you're paying for value of service delivery and not for the volume of service delivery. And then the next one is strengthening the workforce and economic development. And again, that's an area in which, when we talk about some of these services, even locally, we're challenged from time to time related to psychiatric services, especially in Hillsdale County. So those were the 4 strategic areas. She did kind of talk about some things as a community mental health that they see related to vulnerabilities and how a community mental health should be looking at those. And a lot of that is around your administrative costs, around ensuring that there's standardization within the region. So as you know, we're part of this 21 counties now. So really trying to look at that services across that region, no matter if you went to Saginaw County or if you came to Jackson County for services, that you'd get the same level of service regardless of where you were. And the same thing related to rate, making sure that the rate that's provided is equitable across the region. So those are things that we are working on as a region and do have as part of our strategic plan. The other thing that they talked about and shared, and I talked about this here earlier a couple of months ago, was related to the threat that they see related to privatization and really no longer having the public safety net for behavioral health services. One of the things that as an association and as a member of that association, Lifeways has been a part of looking at developing what's called white papers to really look at the system as a whole, to kind of talk about its history, how we got to where we are today. These presenters were actually there that are doing the research paper, and it was really nice to hear that as they look, and they do this across many states, so that they're familiar with models that other states have related to the delivery of mental health services and what they've seen related to the impact of privatizing mental health services and removing that safety net that people have in their communities. And that's not always been a positive thing as a result of that. And so this paper talks about the benefits of the system here in the state of Michigan, and the fact that Michigan is actually a leader related to how we deliver health care for behavioral health services, and all of the movement that we have done over the last several years related to that. We are going to be, the paper should be done in January. I'll be sharing that with both county commissions because it's important that we advocate on behalf of the community mental health and protecting that safety net that's there for our communities. The other thing that I wanted to talk about was related to some legislative issues that are out there. You may be aware of the federal bill related to assisted outpatient treatment, and that kind of ties into the Mental Health Wellness Commission in the state of Michigan, in which they talked about the need for some legislation to be changed to allow people, especially family members, when an individual is in crisis, the HIPAA and some of the rules around confidentiality actually prevents those in the field for being able to reach out to the family members that can be of assistance for those people when they are in crisis. And there's a bill out there, Senate Bill 1052, that actually would allow the ability to have that coordination with that family member when somebody is in crisis. So that's out there. We're hopeful that will be supported. The other thing I talked about, it's probably been at least almost a year now, maybe 6 months, was about the OK to Say hotline. This is actually out there now. It's for schools to educate the youth about the ability to anonymously report if they see or hear of any type of concern related to a fellow peer at school, so that we can prevent any tragedies in the communities in the state of Michigan. So this is an anonymous hotline. Schools are aware of it, and it is getting out there. So I wanted to share that. And then the last one is related to the Michigan Veterans single line. They are now merging with 211 so that veterans, their ability to access, the complication related to a veteran's ability to access services and where do you go, depending on whether you served active duty, non-active duty. I mean, there's just so many rules that they now have the ability to dial 211 as one main point, and they will connect them with the appropriate resources versus going somewhere and being told you got to go somewhere else. And then, so this is a great benefit for Michigan veterans, and I wanted you to be aware of that in the event that you run into constituents who are in need of services, direct them to 211. And then the last thing that I wanted to mention, and hopefully you've heard about it, we've kind of pulled it together since the last time we met, so I wasn't able to share it, but tomorrow night, we are having an event that is a partnership with Recovery Technology, which is one of our big providers, as well as the Michigan Theater is actually providing the facility for us for free. We're having a comedy event for veterans. And why this is important is because one of the individuals, and he'll share his story, is an individual who is a vet, who receives services, and it's about reducing stigma. We're never going to reduce stigma if people aren't afraid to talk about the fact that all of us from time to time, or family members, experience challenges, and it's okay. It's okay to seek out services. It's okay to seek out treatment. This event is going to be a wonderful event. It's free. This flyer here, we had 3 individuals that are comedians. Some of them are well-known, Bob and Tom Show. The main speaker, he actually, a comedian, he is known nationally. So I just wanted to hand these out, encourage anybody. I mean, a free comedy event. It'd be great if we could have a great attendance at this. I would have greatly appreciated it. So could I approach the chair?
Looking for a motion to receive?
So moved.
Thank you. All in favor, say aye.
Aye.
And that is it for my update, unless there's some questions.
Thank you. What comments or questions might you have for Mary Beth? Seeing none, thank you.
All right, thank you.
Next on the agenda, we have the medical examiner's semi-annual report.
Good morning, Commissioners. Before you, we submitted a report, for our case studies up till now, and they're primarily a summary of our case studies to date, and then a summary of our suicide dates. And as you can look at our case summaries, we have so far investigated 268 deaths that have been reported to us. 136 of those have been autopsied. Last year we did 138, okay, so we're going to be over that this year, and that's going to contribute partially to, that we're going to be over budget, okay. We've already submitted a request to Mr. Latham. Jill's been working closely, keeping him informed as to our budget and what we need. Well, the one thing that I would like to report is that our revenue has increased, and we're near 100% of our expected revenue already at this time. The big thing to note is that why our autopsies are a little bit higher this year, a couple of things is, one is that we have autopsied more natural deaths. Of the 167 that have been reported that we've investigated, we've done 46 as autopsies. The problem with those are most of those have been young people under the age of 50, and those we have to make sure are not caused by other things, such as, accidental drugs, or other undeterminable illnesses. And so those have been autopsied and have increased our numbers there. On the average, over the past few years, we have been averaging approximately 12 to 14 autopsies per month, and right now we're averaging at the higher end of that range, and if we continue for the rest of the year, we're going to be, in the 160 autopsy range. And each year it seems, that we're staying about the same, but creeping up, with the increased, number of deaths. In the future, also, one of the problems that we may be seeing is families and persons not claiming, the decedent, okay? And so, therefore, as the county, we may be having to, take care of that issue and dispositioning of the decedent. The other thing is Jill right now is working on a 5-year statistic report because we're going to have a drug summit at Jackson Community College in conjunction with multiple departments in the county, including the prosecutor. And we're going to be looking primarily at our heroin-related deaths since it's becoming an epidemic across the country. And if you look at, go back to the case studies, our undeterminable deaths that we've had 29 deaths, 28 have been autopsied, and then you look farther down, 27 of those have been determined to be drug abuse or complications of drugs and various drugs that have been used. The other thing that I would like to make you aware of is, everybody across the country has been hearing and looking at Ebola for the medical examiner's office, and that becomes one of our issues if someone does die. I will tell you it is a very low risk that we will have an Ebola death in Jackson County, but not impossible, especially with Western University of Michigan and Michigan State having very high numbers of patients that are students that come from Africa. So it is possible, but highly unlikely. But however, someone who dies from Ebola is probably the most contagious at that point, so we're going to have to, to look at that. That's actually being looked at by District 1 medical response team, which I'm a member of it from both as the medical examiner for Jackson County as well as from the hospital with medical control. And a lot of the states are looking at trying to get designated hospitals that would be a center that once someone is identified, they would be transported there and then taken care of. So that's a summary of my report.
Thank you, Dr. Mano, for that detailed report. What questions or comments might you have for him? Commissioner Leitner?
I just have a question on body removals. I guess I don't understand why that's contracted out to Mason, Ingham. Can you explain that to me? Because I don't understand.
How do you mean? Okay, because what happens is that a case that becomes a medical examiner and we end up having to do an autopsy on it, what ends up happening is we have to remove the body and transport the body to the location of the morgue. There's no service that will do that. Okay, the funeral homes won't do it. We as a county do not have a morgue. We do not have, any system for transporting bodies, so you have to rely on the ambulance services for doing that so that you do it with respect for the decedent. And what ends up happening is that we contracted it out to the lowest bidder.
Okay, so where do you perform the autopsies then?
The autopsies are performed 2 places. If it is one that we can transport the body to the morgue at Allegiance Hospital, okay, then it is performed there. We have a contract physicians from Oakland who are forensic pathologists that come here and perform the autopsies. And we try and keep it locally so that we keep the control of the costs down, so that we have minimal transport, so that we don't have to transport to some place like Oakland County to their morgue, so that we have to pay for transport there, back. Police who have to investigate have to transport their persons there, so they have to pay overtime for all of that. Okay, so what we do is arrange so that it is done here, but from the scene to the morgue, the body has to be transported, and we have to have a service that does that.
Okay, and so none of our ambulances have that service, or they just didn't bid? They
Well,
didn't come in under bid?
They bid, okay, but what
Right.
ends up happening is originally we had the contract with Leslie Ambulance. Leslie Ambulance was then taken over by Lansing Mason, and none of the other ambulance services have bid under that, okay? All the other ambulance services will charge a fee at the going rate, okay? And so we contracted it out to get the best deal for the county. All the services, I try and contract it out and look at it to get the best deal for the county.
Okay, I get that. I just wanted to get clarification, I guess, on that, because I just had a personal experience, and an ambulance from Jackson County had showed up first, and then they left, and then we had to wait 2 hours-ish for someone to come get the body. You know, and I just am like, this is,
If that
seems
happens,
silly.
if that happens with time, we tell the people to let us know so that we can investigate as to why. Because what ends up happening, that as soon as it is investigated, the investigator calls and activates the Lansing Mason to transport. If it's taken 2 hours, it needs to be reported to our office so that we can investigate it.
What other comments or questions might you have? All right, thank you for that report.
Thank you. Have a nice day.
Thank you. Next on the agenda, we have Health Department, the contract agreement with Michigan Department of Environmental Quality. I'm sorry, Department on Aging. Thank you, Marcy. I'm glad one of us can read and follow the agenda. Thank you.
Let me set this up. Excuse me. Okay, Department on Aging monthly update. And I wanted to start out with my report to review the strategic plan. It's part of your packet, but I wanted to go quickly through some of the slides. And it incorporates the county's strategic plan, and we're part of the community and social supports priority of the county's strategic plan. And then there's a layout of the Jackson Way and how the vision and values and our goal of customer service, being fiscally good stewards, quality, learning, and growth. This is a county-wide kind of diagram, and then I'm flipping through how, as a Department on Aging, we view how we provide services. Our vision is, of course, the county's vision, and our values are the county values of quality, integrity, community teamwork, efficiency, and accountability. And we have what we call an aging high performance groups, and that started in 2013, and then again in 2014 we have employee groups, what we call focus groups. And it's from those groups then that we have these different goals that we're working on for the coming 3 years, such as increasing public awareness of what services the Jackson County Department on Aging has and the different ways we plan to do this. Having timeliness of meal and home care assessment reviews. And I would like to mention now that at Personnel and Finance, there's information that in order for us to have more timely in-home assessment reviews with our home care clients and Meals on Wheels clients, I'm asking if we could change a full-time social work position to 2 part-time positions. And that'll allow us to have more hours to get out in the field into people's homes and talk about what services are available, both from the Department on Aging and elsewhere in the community. So that will be in Personnel and Finance. Enhancing home services for seniors who don't have social supports to find out other ways that maybe we could help people, depending on resources, our resources. Finding out what I mentioned before, young seniors, what are their interests, what kind of things, programs might we offer that aren't available elsewhere in the community. Strengthening relevancy with all stakeholders, we'll work on that as far as in the community as well as other home community service agencies. Again, public awareness, supporting our staff, offering educational opportunities, meeting with clients and family caregivers about what our strengths are, weaknesses, opportunities, and threats. And related also to the request from, instead of a full-time position, to have 2 part-time social work positions, the National Citizen Survey, we asked people to prioritize as essential, very important, somewhat, or not important, these different services Department on Aging doesn't provide transportation, but we hear about that being a need in the community, so that was one of the questions. But second to transportation is information about services and how to get them. And that is a lot of what we do. With our caregiver information and assistance, people call in and ask for information. Medicare Medicaid Assistance Program, we talk to a lot of people about Medicare. And then our in-home assessments is a time to meet face-to-face with the senior and family members and talk about what's your situation, what resources are available, how do you access them. And also our prioritization of services, we did that January of 2013. And meals are top priority, bathing assistance, lighthouse cleaning, in-home respite. And then operations, we look at our data tracking. We want to use continuous process improvement, CPI tools, to look at, what are we tracking? Some things are required by grant requirements. Are we doing it the most efficiently? Is the information useful, that type of process? Again, other goals for quality, lowering home care worker turnover, looking for hidden efficiencies, CPI. And then, as I just mentioned, our request to change a full-time social work vacancy to 2 part-time. Fostering employee input in addition to the employee task groups that we have, engaging our employees. And this is just a kind of one-page picture of our strategic plan and how it involves operations, workforce, our customers, and our services, which all tie in together. So just a real quick overview of our plan and how that folds in with the Jackson County plan. So any questions about that before I continue?
You did a very fine job of coordinating, collaborating with the existing documents in place.
Okay. And you see this, I'll mention it right now, and that's what these goals are. I brought these up. There's an event that is being planned by Friends of Jackson Seniors. They're a nonprofit organization that supports senior services. And they're going to have a fundraising event to raise money for Meals on Wheels, and that'll start shortly. They applied for a license from the Michigan Attorney General to solicit donations, so that license has to come first. And then their website will go live. But I wanted to let you know, because before I see you again, it might go live and we'll be getting the word out for the Friends of Jackson Seniors. But the main then celebration will be March 5th. And the first 100 people will have, as a memento of Meals on Wheels, a bowl hand-painted by a senior or a Meals on Wheels advocate. So this is something new for Friends of Jackson Seniors. More information to come. Close this. Okay. And I mentioned the changing, asking Personnel and Finance about changing the full-time social work position to 2 part-time. And also at Personnel and Finance, there's a request to replace one of our meal vehicles, one of the vans, a cargo van. So that'll be coming up at the Personnel and Finance meeting. And by the way, a few years ago, I did cost comparison. If we didn't have our own fleet, if we paid volunteers to use their vehicles, which would mean we would have to hire someone to coordinate those volunteers, when you factor in the cost for that to switch to volunteer transportation, it's pretty much a break even when I take into account insurance covering the vehicles for the fleet. So that's why it really is working well for the county to use a fleet, and we pay our drivers its minimum wage, but then we have a consistent workforce. In Lansing, in Ingham County, people are going without meals because they don't have enough volunteers to deliver those meals. So by our having meal transporters, again, that consistency, they get to know their route, they know if something doesn't seem right, so-and-so's always here on Tuesdays and they're not answering their door, and we call emergency contact people. So that is, it's not only a meal, but it's a check on these people too. And our meal transporters are very, very key in providing that part of the service. And we found out recently that the Word of Light location on Cooper probably won't be available after December. So we're trying to reach out to find if there's another location in that vicinity that we could have a nutrition site. Lori Carpenter, our nutrition services manager, has contacted Chalet Terrace. It's a housing complex in that area to see if they might be interested and available. Yes. Mhm. Yeah, hope so. Any questions?
Are the delivery people that you had mentioned, are they limited to 29 or 30 hours?
They're limited to what's called a casual work schedule, so it's 19 hours or less a week. So we have probably 30 drivers to switch in and out and substitutes, yeah.
Thank you.
And we try to deliver the meals between 11 and 1 o'clock so that it's lunch and not mid-afternoon or brunch, yeah. So in bad weather, it's pretty challenging, but our participants understand that.
Any other comments or questions for Marcy? Okay, Thank
Okay,
you for
thank
that
you.
detailed information. Next on the agenda, we have the contract agreement with DEQ.
Good morning, Commissioners.
Good morning.
This is our standard contract agreement that we receive each year from the Department of Environmental Quality, and it helps to cover the expenses of the number of the services that we provide in the Environmental Health Division, including the non-community Type 2 public drinking water supply, long-term water monitoring, if we're doing some of that with DEQ, swimming pools, septage, waste, and campground programs. There's a slight decrease in the amount between what we got this year and what we're getting in 2015-16 or 14-15 budget, if you will. It's about a $1,200 decrease, and it's due primarily to some changes in the Type 2 program, a decrease in the number of systems that we have to monitor. Other than that, there's no changes in the agreement.
Right. If anyone may have any questions for Richard, if not, we're looking for a motion and support to send this to the full board. We have a motion and support. Any other comments or discussion? All in favor say aye. Aye. Opposed? Motion passed. That will go to the full board.
Thank you.
Next on the agenda, monthly report.
My monthly report is in your packet, and I'll just scan through a number of things and do some updates and highlights for you. We're kind of disappointed that we didn't receive MDCH's Director's Award this year, but that's okay. We're going to apply again, you can be sure of that, and I think that the health integration work that we're doing will eventually, they will be recognized we'll get recognized for our efforts, and we'll get selected the next time. I know I've mentioned the Jackson Health Plan Corporation asset distribution in previous meetings, probably 2 or 3 months ago at this point in time. We're beginning to move forward on a deliberate basis, if you will, for deciding how those additional resources that will be left over after the plan closes down its final operations next year. And as I've indicated in my report, we're expecting to continue to focus on facilitating access to care for the medically underserved and the high-risk populations in the community, and really using those resources for disease prevention, health protection, health promotion efforts. So that'll continue on into next year. Medical examiner mentioned low risk for Ebola. I agree with him. We are very low risk here in Jackson County, but just so everyone is aware, we continue to be prepared for it. I work closely along with staff with Allegiance Health on preparing the necessary tools and protocols, if you will, that will make sure that if we were to identify someone who might have a travel history to one of the 3 countries of concern, or maybe even coming back from those countries have a set of signs and symptoms that are consistent with Ebola, we are prepared to respond to that. The health officer's primary role is really in conducting monitoring for a 21-day period of time, should that happen in the community, and we have the tools and the resources to do that in place. So I know Allegiance has done a lot of work with that in their ED and throughout the private practices in the community. They, I think, have worked very closely with us in helping to integrate us and their algorithms, and we have integrated them in ours as well. A lot of work continues with health integration. I've kind of highlighted a few of the things that we continue to work on. The provider survey on behavioral health diagnosis is still open. We're trying to get as many providers as possible to complete that survey. And we're working on the other survey of behavioral health providers in the community who are not MDs. And I'm working with the Behavioral Health Action Team to move that forward. Patient-centered oriented research initiative is moving forward. Dr. Mike Klinkman, who's the medical director of the Jackson Health Network, did submit a grant application for that, and we'll probably hear something later this month or the first part of December. And we're really excited about that and being included in that project. And we really have tried, and we really are trying now with everything that we're applying for from a grant perspective, whether it be the state innovation model, whether it be this research initiative, we're really trying to build in the health integration pieces that we want to achieve in the community. And that's kind of I think, a different approach and a change in what we have seen in the past in efforts to do medical research. This is very much medical research oriented, yet we're trying to build in the population health measures of interest for Jackson County. And we still have that other project going on with Dr. Schultz as well, and it's moving forward. Provide you quite a bit of information on the state innovation model update. Dr. Amy Schultz did attend a meeting in Washington earlier this month, and funding decisions are expected this fall with an award start date of January 2015. Again, this is very much a healthcare transformation system type of grant that we've been working hard in Jackson County over many years to develop the capacity and the structure in place to do that. We're continuing work on our lead poisoning prevention investigation and control protocol, and I think we're just about at the point where we'll be re-engaging with the Jackson Health Network staff on that. I'll drop down to personal and preventive health services for a second. I want to touch on MIHP productivity. MIHP is a maternal and infant health program. It's not that we weren't measuring what we were doing in this particular program, it's just what we were measuring wasn't the right thing. So we've restructured that whole productivity measurement system to focus really on what we need to achieve as far as encounters in the field are concerned by staff member, and also focused on clinical outcomes. So that's what we did there. And I'll report further on that once I have more information. We did have a visit from Dr. Carl Pearson, who is with the Michigan Department of Community Health. He's a rapid HIV testing program advisor on September 11th. And we had an overall pretty successful site visit with Dr. Pearson. Just a couple of things we need to do on the paperwork and recording standpoint in the laboratory. And we've already taken care of those and put those in place. So I think we're in good shape. We're continuing to work with our IT department here in the county. They've been very helpful in assisting us in developing an online disease reporting system for all of our schools in the community, and that's something that we recognized as a need we wanted to do much earlier this year, and I think we're pretty close to having that completed. We did receive notification of a Great Start Early Childhood Programming allocation. We usually get this every year. It isn't as much as what we asked for, but it is a little bit more than what we had received this year. So we got $34,000 versus $32,000 that really helps support our Toy Talker program with the early on families and children. Let's see, what else we got here? I think I repeated a couple things in the report on this page 4. We have submitted our WIC Nutrition Services plan for the WIC program. And I appreciate the County Board's support of the Healthy Vending Initiative over on page 5. We're really pleased that you were willing to support that, and I believe that the Health Department building will probably be the first one where we begin to see these new machines placed. And just a quick reminder that the split that we're hoping to achieve in the machines as far as vending options is 40% healthy and 60% traditional. So that's a really nice move in the right direction. We are still continuing to recruit, and actually we did select someone for the recruitment position for the administrative clerk in environmental health, and she is on board. And we're continuing to work with facilities and others on our cat room improvement at the animal shelter. And that's pretty much my summary.
Thank you. What comments or questions might you have in regard to the monthly report? All right. Next on the agenda, on letter G, we have the Health Department resolution to support allocating a portion of tobacco settlement agreement funds to tobacco prevention control. Richard, you did a nice job of presenting last Friday. A lot of information presented to us at the study session. Comments or questions from commissioners regarding any of the information presented? Richard, when I look at the document, the letter B, it makes a statement to request their support of a resolution that advocates that 10% of these funds be allocated by the state for tobacco prevention control. What control would Jackson County actually have in implementing using these funds in a manner which specifically targets some of our bigger concerns and issues?
Well, first of all, I think that what the funds could be used for will obviously be determined by the legislature and the Department of Community Health, and I've kind of tried to outline what those probably would look like, but certainly tobacco remediation efforts at the local level, supporting a tobacco reduction coalition and the work that they continue to do, and hopefully being able to expand smoking cessation assistance to residents in the community, and being able to target that to lower income, higher risk individuals in the community. We know who they are and where they reside in Jackson County. So we hope we will be able to do that.
All right. And I did take the opportunity to go to the county's website, the health department, and find this section that we already have existing and current programs in, because we are receiving additional grants right now in those areas
Right.
as well.
Yes.
Commissioner Duckham.
The tobacco settlement money has already been awarded to the state, and I presumed it's being spent elsewhere.
Yes.
Okay, so if we take from one, we're going to give to you, we're going to have to take from another. Can you tell me where this is being spent at right now?
Yes, it was laid out in our presentation on Friday, and I can quickly page to the appropriate slide where we have that content, just as a reminder of where the funding is currently going. Right now, as Rhonda Rudolph had mentioned on Friday in the study session, $93 million of the annual allocation, if you will, is going toward bond securitization payments. So basically, Michigan mortgaged a portion of its tobacco settlement agreement funds to pay other expenses in the state budget. So that'll go on for, I suppose, quite a few years. $76 million goes toward Medicaid at the Department of Community Health, just to support the Medicaid program. $75 million for the 21st Century Jobs Fund. $30 million toward the Family Independence Program at the Department of Human Services, $4.5 million toward aging respite care at the Department of Community Health, $826,000 towards Student Financial Services Administration at the Department of the Treasury, $714,000 to State Police for tobacco tax enforcement, and $598,000 for administration at the Attorney General's office. Our perspective, I think, is that when the state wants to find some money to replace other funds that they might allocate for a more appropriate purpose, they have a way of finding out a way of doing that. That has been what I have seen them be able to do. And we're not asking for a huge amount of these funds to be allocated for this purpose. We thought 10% was a very reasonable request, given that we have had these funds in the state for nearly 20 years. And the need is significant here in Jackson County. In some age groups, particularly in the city of Jackson, 46% of residents are smoking. Over 30% of our pregnant women in the community have been smoking. That's from our data from the WIC program. We really need to do more than we're doing. So I'm hoping that, we'll be working with our state legislators as well through our Michigan Association for Local Public Health to see how we might be able to achieve a win here with these funds.
Thank you for that.
You're welcome.
What other comments or questions might you have for Richard? Okay, according to the agenda here, I am looking for a motion to send this on to the full board.
So moved.
I have a motion. Is there support? I have a motion. Second call, is there support for this motion? Okay, seeing none, we will move on to other business. Claims? I'm looking for a motion to pay the October claims. I have motion and support. All in favor, say aye. Aye. Opposed? Motion passed. There are no other minutes in the agenda. The December reporting schedule, Department on Aging, Health Department, Lifeways, DHS, Medical Care Facility, and the Veterans Affairs. Public comment. Are there any individuals in the audience, including Michael, that would like to make a public comment? Seeing none, are there committee member comments? Are there any other board member comments? Seeing none, adjourn to the call of the chair.